Welcome to medical ratiotheory. This is an innovative approach to the diagnosis and early treatment of chronic and autoimmune diseases. Through initial studies, Dazana have determined that when there is an imbalance in medical indicators, there is the chance that autoimmune diseases or chronic diseases will occur. This imbalance can be undone through interventions that can include use of supplements, lifestyle changes, or diet. Acknowledgement of these indicators can mean that the patient can take action to improve their own health. This groundbreaking theory has been the result of 7 years' research. It is the culmination of the work of a group of dedicated mathematicians and doctors. Their aim was to produce a systematic process that correlates the symptoms of a disease and then, by using the ratio of the medical markers, use it to diagnose and specify chronic and autoimmune diseases. The focus of these tests is to use blood markers to screen patients for hormone and enzyme levels, with a view that any deviations could be the early indications of specific chronic or autoimmune diseases. These diseases could then be treated through a program of hormones and enzyme supplements, diet and lifestyle changes in order to achieve a state of good health and well-being. Additionally, the medical ratio theory can diagnose and treat autism. The premise of the research is that there is an existing biological, physical and mathematical relationship that can be measured, linked, and then any changes can be monitored and linked to a specific disease. And this can be explained through an algorithm. An algorithm is a series of mathematical steps that are used in a computer program to give you the answer to a specific problem or question. The medical ratio theory can detect imbalances in the body's hormone or enzyme production. This will often result in inflammation, swelling of tissues, or unexplained fatigue. Additionally, an imbalance could be the indicator of an underlying genetic disorder, which may be the real cause of a disease, or may cause an organ to perform ineffectively, which if left untreated may result in organ failure. We already know that specific markers will detect specific problems. For example, the thyroid function test is an independent marker for thyroid disease, but often when markers are used in isolation of other tests, the result may be flawed. If several other markers are used, then a more precise diagnosis can be made by using an algorithm. A prime example of the use of algorithms in health and medicine is their use in devising personal training programs. A genetic-based algorithm could offer suggestions for nutritional supplements and hormone therapies, lifestyle changes, including nutritional advice and exercise that can increase the effectiveness of a physical training program. The use of algorithms is not a new approach. Over the past few decades, research into artificial intelligence has been pivotal in the investigations of specific human and animal behaviours. Other applications have successfully solved scientific and mathematical problems. More recently, there has been considerable interest in the use of algorithms within the medical profession. These have been used to identify individual illnesses such as rheumatoid arthritis. However, screening for an illness is not the complete picture. To be effective, a test should also be able to acknowledge the severity of the illness. Finding this correlation has not always proven to be successful. In the case of finding a positive correlation between using a non-invasive gastropanel algorithm, it was found that the results were not able to successfully identify and differentiate between several different diseases. Several academic papers have highlighted the need for an algorithm study that is to diagnose and differentiate illnesses, as it is believed that such an algorithm is a realistic approach to medicine rather than just a theory. The medical ratio theory strives to be that theory. The medical markers that are used in the medical ratio theory are 12 specific blood tests, and these are used to determine specific medical problems. These medical problems can be determined through an imbalance that's found by the results of these blood tests. These markers are either used on their own or in a combination, and then applied to an algorithm to diagnose and determine treatments. The medical ratio theory has targeted the 12 medical markers so as they can diagnose the presence of specific hormones and enzymes, in particular looking for testosterone and T-testosterone, which supports the development of muscle growth, hormones that dictate metabolic rate, estrogen, and 2 separate markers that measure the enzymes that are specific to the liver, because raised liver enzymes can indicate an infection, specialist enzymes that remove waste products from the body at cellular level, lipid markers looking for cholesterol, thyroid function hormones, which can be used to predict cardiovascular health as well. The list includes lupus, vitiligo, hepatic fibrosis, heart failure, rheumatism, rheumatoid arthritis, AIDS, depression, cardiac clots, prostate cancer, lung cancer, blood cancer, ITP, PCOS, and autism. Although there is no cure for autism, as it is not a disease, the use of the ratio theory algorithm can be used to treat some of the medical conditions that are associated with autism. What is of concern is that there has been a steady rise over the past 2 decades of the incidence of people who are now regarded as being on the autistic spectrum. This rise now means that in the USA and Europe, statistics currently show that 1 in 68 people are on the autistic spectrum. The statistics are similar for Asia, except for in Korea, where the ratio is currently 1 in 38. In part, this increase could be due to the knowledge that is now available about autism, and partly due to the diagnosis process. The definition for autism is: autism is a developmental disorder that is characterized by troubles with social interaction and communication, and it's also characterized by restricted and repetitive behavior. Parents usually notice signs in their children in the first 2 or 3 years. These signs often develop gradually, though some children with autism reach developmental milestones at a normal pace, and then they kind of slack off a little bit. Symptoms of autism can include difficulties with social interactions. They may often appear to be remote or difficult to engage in conversations. They have problems with repetitive speech, often repeating what others have said or repeating particular phrases just to themselves. There's usually a problem with non-verbal skills. They usually find it very difficult to read facial expressions or body language. They can often appear aloof, and this can often be misinterpreted by neurotypical people who just think that they're just not interested. They find it very difficult to appreciate other people's point of view. Generally, they lack eye contact. They often find it difficult to look at someone when they're talking to them. They have problems with social and emotional aspects. They usually find it very hard to make friends or involve themselves in small talk. They have their obsessions. They do like making collections of specific things. Their movements can sometimes appear odd or a little robotic in nature. They have a literal interpretation of what is said to them. They find it very difficult to understand metaphors. So if you ask them to walk on ahead, they will wonder why you are asking them to walk on their head. They have problems with personal space. People with autism tend to need more personal space than neurotypical people. They can get very anxious if other people are too close to them or if they touch them. They have sensory issues. They're usually very hypersensitive to sound, taste, touch and smell. A sensory overload can cause a meltdown, which will often appear as if they're being very aggressive. Generally, there are fewer females diagnosed with autism than males. This is mainly due to the characteristics of autism in females. It differs, so there's a tendency that they will blend more into their peer groups compared to males. Look out for these personality traits in girls who may be autistic. They tend to have obsessive tendencies to the point that this could be mistaken for OCD. They're fascinated with certain subjects, and these subjects are usually age-related. They will mimic neurotypical people, so they blend in with their own peer group. They get bored with people of their own age, and they actually prefer to spend time with older people or younger people, usually a lot older or a lot younger than themselves. They very rarely show empathy, and they can appear to be not responsive to the needs of others. It's important to remember that not all the traits are experienced by everyone, and some of the traits can be more apparent than others. Currently, diagnosing autism can be difficult, as there have until now been no medical tests to diagnose it. The usual way in which it's diagnosed is by referral to a neurodevelopmental pediatrician, a psychologist or a psychiatrist, and these doctors usually have a very long waiting list, sometimes up to 6 months. Additionally, the diagnosis process is complicated, as the responsibilities for the process overlap between the healthcare system and education. The medical ratiotheory aims to diagnose these difficulties a lot earlier than they could normally be through the behavioural and cognitive assessments. The term autism covers a vast range or spectrum of abilities and difficulties. But although there are differences, there are also similarities, especially when it comes to sensory difficulties. And these can cause very high levels of anxiety and stress. People who have autism are also very prone to depression. Children with autism have a tendency to have a higher than average rates of eczema, allergies, asthma, ear and respiratory infections, gastrointestinal problems, severe headaches, migraines and seizures. Other studies have researched the health of autistic adults and have found that if medical conditions are not diagnosed early enough, there are patients that are at significant risk for developing diabetes, coronary heart disease and cancer. Adults with developmental difficulties are also at much higher risk for osteoporosis, and they show severe degrees of bone demineralization. Other related conditions include ADHD, hearing impairments, Down syndrome, dyslexia, dyspraxia, epilepsy, Fragile X syndrome, hyperlexia, social communication disorder, and visual impairment. The effect that autism can have on a person and their family and friends can be far-reaching, but with understanding and support, there is no reason why people with autism cannot live their life to their full potential. So an early diagnosis is absolutely paramount. The diagnosis process will involve signing up to the program using the Medical Ratiotheory app. The patient can withdraw from the program at any time. The patient needs to be aware that this is not a one-step process and that any positive changes to their health may take weeks or months. Information needed will include name, date of birth, current email address, and a consent form which will detail the ethical considerations that have been put in place to protect identity and any data collection, as well as highlighting any concerns about confidentiality. After the blood tests have been analysed to check the possible imbalances of the body, the results can then be added to the app. Medical Ratiotheory algorithm is applied to the results. The results of the algorithm are then able to decide if the patient has autism. At this point, advice is disseminated to the patient on a suggested regime of hormone and/or enzyme supplements, as well as on advice on diet and lifestyle. Any changes in future blood tests will be meticulously monitored and recorded and fed back to the patient. Dasana has taken all ethical considerations into perspective and has produced a document that acknowledges all the relevant factors, including consent, deception, debriefing and withdrawal from the project, confidentiality and data protection, and giving advice to patients. Our discoveries, including its core idea, equations and merits of its diagnosis and treatment methods, are in the process of being copyrighted, and they need to be duly certified by internationally recognized health centers and institutions. Software, including an app, is being developed to automate the diagnosis and treatment processes. I hope you've enjoyed this presentation.